Ocrelizumab is an investigational therapy for the treatment of relapsing forms of multiple sclerosis. At the American Academy of Neurology meeting here in Vancouver, we are presenting some of the latest data on the efficacy of that drug. It's quite exciting, some of the results we're seeing. The medication is taken twice a year by injection and it was compared head-to-head to a standard of care first-line therapy known as interferon beta-1a. And in that study, we saw double the efficacy or effectiveness of the treatment on all outcomes, including preventing relapses, preventing disability progression, and preventing new MRI lesions. We combine all those measurements together, we get an outcome called NEDA, or No Evidence of Disease Activity. Over 2 years in the standard of care interferon treatment group, we saw about 25 to 30% of patients only showed no signs of disease activity, whereas 70% were showing signs of disease activity. That's quite a high breakthrough rate. On the other hand, on the Ocrelizumab cohorts, we saw close to 50% of patients over 2 years had no signs of any disease activity, and that's quite remarkable. The Ocrelizumab studies were phase 3 clinical trials, and there were 2 identical trials called OPERA-1 and OPERA-2. 70% of those patients were treatment naive, and these 2 studies had consistent results between the 2, which gives us good confidence that this treatment should be able to go through the regulatory process and be available in the future. That, of course, depends on the regulatory process. But I think it's going to be an exciting opportunity for neurologists to have more treatment options for their patients. Also presented at the meeting are some of the safety and other efficacy data in more detail. And those items are also quite impressive. The safety has been quite good with the medication, and the efficacy across all these measurements, MRI, brain atrophy, disability, have been outstanding. One of the truly exciting things for patients in the future with this type of treatment approach is the confidence of high efficacy, as well as the convenience. They only have to do this treatment twice a year. Compared to taking a pill every day, compared to taking a needle 3 times a week or every day, this is a dramatic improvement in how we apply therapeutics to patients. And I think we're going to see patients happy with this opportunity to have more choice and choice of a very good medication.